Let me ask you something. What if your body was warning you, but not in the way you expect? No dramatic collapse, no sudden sharp pain, just small confusing signals, a little fatigue, a strange discomfort, a feeling that something is off, but not enough to panic. And because it doesn't feel urgent, you ignore it. You continue your day. You delay action. You tell yourself, it's probably nothing. But sometimes, those quiet signals are the most important ones, because not every heart attack starts with intense chest pain. And here is something very important you need to understand from the beginning. The body often sends warning signs before a serious cardiac event, but they are subtle, inconsistent, and easy to overlook. And in this video, we are going to go deep. We will break down the hidden signs, why they happen, how to recognize them, who is at risk, and most importantly, what you should do when you notice them. So stay with me until the end, because this information can make the difference between reacting early and reacting too late. Hello, I'm Dr. Yusoka. Now let's go step by step, because most people are only aware of the classic heart attack symptoms: severe chest pain, collapse, emergency situation. But in reality, many heart attacks begin differently, and sometimes the early signs appear hours, days, or even weeks before the event. Let's start with something critical. The earlier a heart problem is recognized, the better the outcome. Because a heart attack is not just an event, it is a process that builds over time, and sometimes gives warnings before reaching a critical point. The problem is, these warnings don't always look serious. To understand the signs, we need to understand the mechanism. The heart depends on a constant flow of oxygen-rich blood. This blood is delivered through coronary arteries. Over time, these arteries can develop plaque buildup. This process is slow and silent. But as the arteries narrow, blood flow becomes less efficient. And sometimes, before a full blockage occurs, the heart begins to struggle. This struggle can produce subtle symptoms. Now listen carefully. Before the body sends a loud signal, it often whispers. And if you learn to recognize those whispers, you gain time. And in heart conditions, time is critical. One of the most common early signs is unexplained fatigue. Not normal tiredness, but a deep, persistent lack of energy. You may feel tired even after resting. Simple activities feel harder than usual. You feel drained without a clear reason. This happens because the heart is not pumping efficiently. Your body is receiving slightly less oxygen than it needs. And over time, this creates fatigue. This is where many people get confused, because it is not always pain. It can feel like pressure tightness, fullness, burning. And it may come and go. It may last for a few minutes, then disappear. So people ignore it. But recurring discomfort should never be ignored. Breathing changes are another important signal. You may notice getting tired more quickly when walking, feeling slightly breathless during normal activities, difficulty catching your breath. Even without chest pain, this can indicate that the heart is under stress. Now think about this. If everyday activities suddenly feel harder, your body is telling you something. And ignoring that signal does not make it go away. Heart-related discomfort is not always in the chest. It can appear in the arm, the shoulder, the neck, the jaw, the back. And often it feels vague, not sharp, not intense, just unusual. That is why many people do not connect it to the heart. Some people experience nausea, indigestion-like feeling, stomach discomfort. This is especially common in people who do not have classic symptoms. And because it feels like a digestive issue, it is often ignored. Another subtle but important sign: sudden sweating without physical effort, feeling dizzy or lightheaded, a sense of weakness. These can indicate that the body is under stress. Now here is the problem. Each of these symptoms alone may not seem serious, but when they appear together, or repeatedly, they form a pattern. And that pattern should not be ignored. There are several reasons. First, the symptoms are mild. Second, they are inconsistent. Third, they do not match expectations. Fourth, people do not want to overreact, so they delay action, and that delay can be critical. Certain people should pay extra attention. Those with high blood pressure, high cholesterol, diabetes, smoking history, family history of heart disease, sedentary lifestyle. But here is something important. Even without risk factors, symptoms should not be ignored. Having risk factors increases probability, but absence of risk does not guarantee safety. Listening to your body is always important. This is critical. If symptoms are new, unusual, persistent, or worsening, do not ignore them. Seek medical evaluation, especially if multiple symptoms appear together. If symptoms suddenly intensify, strong chest pressure, severe shortness of breath, pain spreading to arm or jaw, dizziness, or fainting, this is an emergency. Immediate action is necessary. The difference between early action and delayed response can change outcomes completely. Recognizing the signs early gives you time. Now let's talk about prevention, because prevention is where real control exists. 1. Regular checkups. Monitoring your health helps detect issues early. 2. Stay active. Movement supports heart function. 3. Healthy diet. Balanced nutrition reduces risk factors. 4. Manage stress. Chronic stress affects the cardiovascular system. 5. Sleep quality. Good sleep supports overall health. Never underestimate small changes in your body, because sometimes small signals carry big meaning. A heart attack does not always begin with a dramatic moment. Sometimes it begins quietly, and the body gives you a chance to notice. If this video helped you understand the hidden signs of a heart attack, support the channel by liking, subscribing, and sharing your thoughts in the comments. Have you ever experienced unusual symptoms like these? Share your experience, because awareness can help someone recognize the signs earlier. And remember, your body speaks before it shouts. Learn to listen. This is Dr. Yusoka.